My name is Alyson McGregor, and I'm an associate professor of emergency medicine at the Warren Alpert Medical School of Brown University. Also the co-founder and the director for the Division of Sex and Gender in Emergency Medicine. As I was completing my emergency medicine residency at Brown University, I was fortunate enough to stay on as faculty. And it's an academic institution, so there is this desire to do some clinical research there. As I was looking for research projects and advisors, what I've noticed was I would tell people that I wanted to study women's health, and they thought I meant obstetrics and gynecology. And so I started to wonder, why was this assumption that women's health really just distills down to our reproductive health? And around that time, the cardiovascular literature was also showcasing that women present differently with heart disease. And so I thought, well, if they present differently for heart disease, I'm in the emergency department all day. I see women with strokes and cancer and infections and trauma. How are women different in all of those things? So that's when I really started to build my research on the biological differences between women and men, and the fact that women have the health disparity, the higher mortality rates, and the bias that's ingrained into our medical system because we've been researching men through our history and assuming that that would apply to women. And we have discovered that it doesn't quite fit. And to combat this issue, we need a 360-degree approach that tackles both funding research and educating the medical community. That's why I'm excited to be part of WHAM, who is working tirelessly to accomplish both. I know that this group of women will drive lasting change in women's health.